Good evening, everyone. Thank you so much for joining another one of our webinars at Plant-Based Health Professionals UK. I hope you're all settled in for the next hour and have something nice to eat or drink and are ready to hear all about our latest initiative, Plants First Healthcare, which was launched today. For those of you who haven't met me before, my name is Rahini Bajekal. I'm a nutritionist and the communications lead at Plant-Based Health Professionals UK. And the team, along with Greener by Default and a number of other organizations, have been working hard on this initiative for the last few months. And together with all of your help, we're so excited to launch it. And this webinar is going to be all about the initiative, the background evidence, our recommendations for future action, and how you as an individual or as an organization can affect change in healthcare settings and help to transform food and healthcare together. So now I'd like to welcome the first speaker for this evening, which is Dr. Shireen Kassam, who doesn't really need an introduction to most of you here. She's the founder and director of Plant-Based Health Professionals UK and also a consultant hematologist at King's College London. And we will then be joined by Heidi Fritz, who's a registered dietitian and healthcare director at Greener by Default. And she's going to be sharing everything about her organization and all the incredible work they've done over the pond and how they're going to be bringing that to the UK. So really exciting. And we're going to be sharing relevant links in the chat as well. Please do share your burning questions in the Q&A box at the bottom of the screen, because I'm going to be putting these to Shireen and Heidi at the end in our live Q&A. So see you all in a minute and best of luck, Shireen.
Great, thank you everyone, and really lovely to be here with you tonight. It's been over a year since I've been part of a webinar as a speaker with Rahini, so a long time coming. So we're going to be talking about food and healthcare and the case for change. And much of this information may be familiar, but I just wanted to set the scene for the work we're planning to do with Greener by Default. And for those of you who don't know us well, we are an organisation that provide education and advocacy around healthy plant-based nutrition and lifestyle medicine for prevention of chronic conditions and also for supporting planetary health. And our theory of change is that if we want to witness a transition to a plant-based food system, we need the healthcare professionals to accept and adopt a plant-based diet and lifestyle as one that can benefit themselves, their patient, and the planet we inhabit. And we've got lots of information about who we are on the website from a recent survey from our research assistant, Isabel Sadler. So today, we're delighted to be able to be part of the launch of three combined initiatives. So on the left-hand side, you'll see a new report published today by the UK Health Alliance on climate change around their policy recommendations for government and healthcare for building a healthy and sustainable food system. On the right-hand side, we have a report, again, put together by myself and our research assistant, Isabel Sadler, around food and healthcare and making the case for the UK and the NHS to transition to a food system that prioritises and normalises plant-based meals as the default option. And in the middle, you'll see the name of our initiative, which is called Plants First Healthcare, which is launched formally today, endorsed by 24 organisations, 1,200 healthcare professionals, and we've got quite a lot of media exposure in The Independent. And my colleague LJ Smith has been on Radio 5 Live today as well. So it's been a good day, and it's nice to be here to share why we're so interested in this topic. So we all know that we talk about food constantly because our food system is driving all of these key interlinked crises: the health, the climate, the biodiversity crisis, and also driving antibiotic resistance, pandemic risk, air pollution, and of course, social justice. World Food Day today recognises food and healthy diets as a right that should be afforded to everybody globally. Yet nearly 1 billion people remain hungry, while at the same time we slaughter 80 billion land animals and 2 trillion fish for food that really is harming the planet. So what is the case for change? Well, we know that our unhealthy diets are a leading cause of death and disability around the globe. And if we focus in on the UK, we're over-consuming ultra-processed foods, and we're not consuming enough of the foods that promote good health, which is fruits, vegetables, whole grains, beans, nuts and seeds. And from the most recent analysis, we know that high intakes of red meat and dairy are leading to 42,000 excess deaths in the UK, whilst at the same time, insufficient intake of plant foods is resulting in 70,000 excess premature deaths from poor diets. At the same time, our food system is harming the planet, with over a third of greenhouse gas emissions coming from the food system. And of the food system emissions, more than 50% come from animal agriculture, which at the same time is the leading cause of biodiversity loss. If we focus in again on the UK, the food system accounts for about a fifth of greenhouse gas emissions, but that rises to around 30% if we factor in emissions from all the food that we import as well. But it's interesting to note that the production of red meat and dairy has an oversized impact, creating more than 70% of emissions from the farming sector in the UK. And we mustn't forget that without transitioning away from animal agriculture, we are not going to be able to meet our targets for climate and nature goals. And we have to note that we've now breached 7 out of 9 planetary boundaries, that we are almost, if not already exceeded 1.5 degrees of warming, that the Amazon forest is an emitter of carbon rather than being a carbon sink. And this is all due to our global food system. We must also consider land use, because this is a huge opportunity for us. So we know that in the UK, 70% of our land is devoted to agriculture. But of that, 80% or more is used to raise animals for food. And if you look at this map that was in the National Food Strategy, you'll see how much of this land is used to raise animals for food or to grow food to feed our animals. But it's not only that. If you look on the right-hand side, that same land mass again is used overseas. So we're using 2 of our sort of UK land masses to produce food, but really it's because we're prioritising the production of animal source foods, and yet we have to import over 50% of our fruits and vegetables. If we were to transition away from animal sourced foods and animal farming, we would release 75% of farmland back to nature so that we could restore it and also capture carbon. And this is our greatest opportunity when it comes to transitioning away from animal foods. So how much do we need to change our diets? Well, this is from the World Wildlife Fund. We need to cut the emissions from our diet by more than half to meet the IPCC 2030 target. So we need a drastic change for us in the UK. And what we eat really matters. If you look at this graph and you go down the x-axis, you will see that as you cut out animal source foods, you drastically reduce the emissions from our food system, and with a vegan diet, only emitting around a 25% of carbon and methane and nitrous oxide that a typical animal-based meal would be emitting. So a major impact there. And of course, we always get asked about dairy, and actually all the plant-based dairy alternatives are better on all metrics: greenhouse gas emissions, land use and water use. So cow's milk at the top and all the non-dairy alternatives going down the right-hand side. So what we know is that we need to transition to a diet that centres fruits, vegetables, whole grains, beans, nuts and seeds as the primary foods that we're eating, whilst limiting drastically the amount of animal source foods. And the Eat Lancet Planetary Health Diet makes it quite clear animal source foods are not necessary. Dairy is not required for protein or calcium. And if we are going to continue to eat animals, it should be limited to 1 portion of red meat, 2 portions of poultry, 2 portions of fish and 3 eggs per week. And that would go a long way to saving the 11 million premature deaths that occur due to an unhealthy diet currently. So in high-income countries, we need to make the most changes, reducing red meat consumption by more than 90%, reducing white meat consumption by around 60%, whilst at the same time increasing considerably, up to 400%, the consumption of whole plant foods. So plant-based diets are really a solution to our health and our climate crises. We know from webinar after webinar that there are numerous benefits for plant-based diet for maintaining a healthy weight, improving cardiovascular risk factors. They're high in fiber, they keep you satiated, they're low in sugar, and they're appropriate across all ages and stages of life. And I've summarized for you, and you can have all of these slides later after this webinar, that we've known for decades that we can reduce significantly the burden of chronic disease by transitioning to a plant-based diet. Some of our commonest conditions like heart disease, type 2 diabetes, and some of our rarer conditions like Parkinson's disease, and also reduce the risk of premature mortality. There are significant savings to be made, and this is referred to in our open letter today. There's 2 recent reports modelling the savings to us as individuals, the environmental benefits, and also the savings to NHS if we were to transition away from animal-based meals. So where are we in the NHS? This won't come as a surprise. These are all pictures that people have sent me. This is from the current NHS weight loss app. Does not really paint the picture we want it to. A steak shown as a dinner item there. There's no beans on this plate at all. There's hardly any protein sources that come from plants. These are pictures people have sent me from their hospitals. Unfortunately, the right-hand picture there is from my hospital canteen, along with this fresh start to your morning. I mean, this is the worst one. Nice to meet you. I mean, what sort of message are we giving to patients and staff? Now, we have done a lot in our little silos about changing some of the menus, and this is our recent menu that MediRest has rolled out across the whole of their sort of 30 NHS sites in the UK. And you can see that, actually I didn't mean to circle that, you can see that all the veggie and vegan dishes are listed at the front actually, but what you see is there's mixed messaging, because in the red you can see a heart healthy symbol by the beef dish there. And that makes no sense to me if we're trying to prioritize, sort of individual health and also planetary health. And this is the current reality when people ask for plant-based meals in hospital. It's very varied. You might just get a banana and some vegetables. Some of them actually look quite good, but it's not uncommon to just find the side vegetables and some chips. So what we've done, and what Isabel Sadler done for us, is analyse where the NHS plans to be and what they have committed to in their green plans, because of course the NHS was the first healthcare service around the globe that committed to net zero emissions by 2040, including all its sort of procurement by 2045. And in its green plans, the NHS Trust sets out what it's going to do to meet these targets. But they fall short at the moment when it comes to their priorities around food. You can see that most green plans refer to eating local, but that's really difficult when we don't even produce the fruits and vegetables we need to feed the nation in our local areas, let alone our own country. And of course, we know what you eat is much more important than where it comes from and how it was produced. So there's only 5% of green plans that talk about promoting and encouraging staff and patients to choose plant-based options. And that's why we need our initiative and have teamed up by Greener by Default. When we actually have surveyed our patients, and this is a survey we've published from King's College Hospital, we specifically asked them about removing some of the most harmful foods, so processed meat and red meat. So processed meat because it causes cancer, and red meat because it's not healthy and it has an oversized impact on the climate. And actually, patients don't disagree. They would support, they're either strongly agree, or are neutral about this. So I don't think we have to worry as much as we do about preserving choice, because I think our patients understand. Similarly, when we've surveyed our staff at work, this was during our Veganuary event recently, most people were happy to hear about adding dishes with lentils and beans and mushrooms. They didn't mind us removing processed meat. They were happy to have alternate plant-based milks instead of dairy milks. And what was surprising, though, is that our staff, only 5% of our staff had heard of the Eat Lancet Planetary Health Plate. But as we know, people prioritize convenience, taste, cost, and of course, health is important. So I think that should be a motivating factor for our staff. We know that plant-based meals can be healthy, but otherwise they need to be familiar, tasty, convenient, the default option, essentially. We've also conducted a one-poll survey of 2,000 UK residents that have spanned from 18 to 70 years. And again, the results are in our report that we've published today. And again, people were very certain that hospital meals needed to change. Only 7% perceived them as being delicious. Most thought that it lacked flavour, and they didn't even think that they were that healthy. But actually, people would consider plant-based milk alternatives. And these are a group of people that only 2% of the participants identified as vegan, and 35% would support a switch to entirely plant-based meals, which is not even something that we're talking about today. We're talking about normalising plant-based meals and making them the default option. But again, people want to prioritise taste, familiarity, convenience, and of course, price is an option, you know, a priority for people who are visiting or have family members. And people are interested in having healthy meals, of course. So the public currently perceive the benefits of meat-free meals as being friendly for the environment. They're healthier. They might encourage healthy eating outside of the hospital. They recognise that they're inclusive, and some also felt that it could save money, which is the case. And so really we're coming to our call to action. We want to really call us all to action to normalise plant-based meals in healthcare settings, making them the default option, flipping the norm. And there's no better organisation to work with to bring that to the UK. So our action plan is to now be working actively with Greener by Default, and Heidi will tell you about their work and how we can work with them. Tanya Hafner, who leads the BDA Sustainable Diets Group, is providing education for dietitians, which I think is greatly needed, because the dietitians really have to be on board with this transition. And our campaign partners, Real Zero, is supporting us by bringing together the wider stakeholders. So not only GBD and the BDA groups, but also the procurement and the supply chains and various stakeholders such as the NHS food programme are all now together in a working group trying to make action a reality. So I just wanted to leave you with thinking about the tobacco industry, because I feel like food and healthcare is now the new tobacco. And it might sound a bit dramatic, but I think, you know, this is how we need to think about food currently. So in the 50s, hospitals were allowed you to smoke in their hospitals, and doctors actually advertised and promoted smoking as desirable. Over 50 years later, after the Surgeon General declared cigarette smoking as a Group 1 carcinogen, it was no longer possible to smoke in hospitals. And actually now we support our patients with active programs that support them to quit smoking. But when it comes to food, this is my hospital, this is where we are. We're kind of stuck in the 50s. We haven't moved on. But we're lucky enough that we now have gold standard examples that Heidi will be talking about in New York City. There's no reason why we can't do this now in the UK. And what I really hope that maybe in the next decade, we do what Denmark did a while back and have a quit meat helpline, really people to move away from animal-based foods. So I wanted to leave you, and I hope this works because I have got exactly 2 minutes. Sugar-sweetened beverages, creamy toppings.
It's not about really putting build all of our meals or most of our meals.
Food for me is something that makes me feel really angry. I work in one of the biggest hospitals in the country, and we are still serving processed red meat, a Group 1 carcinogen as classified here in 2050. So that's sausage and bacon and deli meat. So really, I think we need to look very carefully at the foods that we serve in hospitals and move to promoting healthy plant-based diets.
70% of my work is and I think if people wanted to help them side, I could probably put my people who would obviously remember so I think it really is. When you're in hospital, you need the help of doctors and nurses to get you well. So it makes sense to be able to use the food that you're eating as part of that journey to recovery.
You want your patients to get really well, get them on a plant-based diet, low processed food, make sure they're drinking enough water.
There seems to be a real difficulty in shifting the emphasis in hospitals on food. People are very concerned about restricting choice, but we're doing no one any favors by giving them food that we know to be harmful. And we wouldn't do that with anything else. You know, we have smoke-free sites for a reason, because tobacco smoke kills our patients. Well, so does poor diet, the leading cause of mortality and morbidity.
So to my fellow health professionals, I'd like to say to look more broadly at the factors that are playing a part in the health of your patients.
Most of the people living in the UK have never been educated on what healthy food actually is.
We're constantly fixing people who are broken. And what we need to do is to really invest in preventing disease before it occurs.
Great, thanks everyone. So thank you for supporting our campaign, and it's a great pleasure to be able to hand over to our campaign partners from Greener by Default and Heidi Fritz, who will take you forward with how we can work with them and what the initiatives might look like.
Heidi, are you able to turn on your video and audio as well? Just should work now. Hi Heidi, can you hear me? Oh, perfect.
Can, yes. I didn't have that option before. So I'll go ahead and share my screen. All right. Well, thank you so much, everyone. And again, my name is Heidi Fritz, the Healthcare Director with Greener by Default. And I'm really excited to be here today to share with you about our work. And we are a nonprofit based in the US that applies behavioral science to food policy, nudging diners towards sustainable plant-based food while preserving freedom of choice. And we are thrilled to be partnering with plant-based health professionals and others on this initiative to adopt a plant-based by default approach to menuing in UK hospitals. Since Dr. Kassam has really provided a nice overview of the key issues and the context, I'll be focusing on the rationale for our approach and explain what makes these strategies unique and successful. All right, so our program was inspired by behavioral economics and specifically the book Nudge, which looks at the impacts of defaults and nudges on human behavior. So a default is just the option that people end up with if they don't make an active choice. And just a regular example of that outside of food is many people's phone ringtones and laptop settings that remain at the defaults that they came with right out of the box, because it can just be a bother to go through the settings and change them. And so the authors of Nudge, Thaler and Sunstein, explain that people tend to stick with the default or the status quo, partly because it's just one less decision to make, and partly because defaults are often seen as more socially acceptable. And defaults and nudges can actually save lives. And a great example of this is organ donation. So there was a study that revealed that European countries that have an opt-in system for organ donation have an average rate of around 15% participation. So it's fairly low. But those countries with the opt-out system, where by default you are an organ donor, those countries have close to 100% participation rates. And so that really just shows you the power of having a default. When you combine plant-based foods with defaults, you get Greener by Default. And in almost every food service setting right now, meat and dairy are the expected default. People have to specially opt in to plant-based options. which usually only vegetarians and vegans will take the time to do. So we're working to change that by making plant-based the default and giving people the choice to opt into meat and dairy. And this way, everyone still has complete freedom of choice. The meat and dairy are still on the menu, but the more sustainable and health-promoting option becomes the default. This strategy is flexible. It can be implemented in any environment where food is served across different cuisines and dietary preferences. And it's also cost neutral at the very minimum and can many times save money. Want to also note that this is an appealing program for food service and catering operations because you can continue to meet diner preferences without the backlash that might be in place if you were to offer a fully 100% plant-based menu. Our work definitely focuses on what we feel is the greatest opportunity for impact when it comes to supporting population and planetary health. So really the majority of UK and US populations are flexitarians. And by that, we mean people that aren't going to go out of their way to request a plant-based meal, but who are happy to stick with it when it's the norm, and especially when the food is delicious. And that's really the focus of our work. So this is where we can see the biggest change and the biggest impact is with the flexitarians. And our goal is really just to make plant-based foods appealing and accessible to all diners, not just vegans or vegetarians. We often hear hesitation about addressing the food being served in hospitals due to concerns about upsetting people, because food is really a deeply personal and emotional topic. But if you think about the current standard dietary pattern with meat and dairy in every dish, it's not really an inclusive way to serve food. But offering plant-based meals by default is definitely more inclusive of many UK adults who have a food allergy and the roughly 2/3 of the global population that has lactose malabsorption. It's also more inclusive of many religious groups that restrict or avoid certain animal products. It includes the 58% of British people who are trying to eat less red meat and meat overall, as well as aligning with NHS recommendations to consume less red and processed meats. And finally, there's a sizable and growing number of UK consumers who do identify as vegetarian or vegan, and we want to be inclusive of their needs as well. So the bottom line is really that plant-forward menus can benefit the quintuple aim of healthcare improvement by meeting carbon reduction commitments while also saving money, unlike many other sustainability projects that require more expensive upfront investments. And they also help improve alignment with care team and institutional values like health equity and staff well-being by serving more inclusive and healthy foods, which can help attract and retain staff, as well as increasing food service and catering team skills. Serving more plant-based foods also can really enhance the patient experience while simultaneously addressing the burden of chronic diseases and helping to improve population health. If you look at having plant-based meals as the default, that really it just normalizes these options. And it gives patients great opportunities for exposure to foods that are already likely to be encouraged by their physician or their dietitian, which then in turn makes it easier for them to follow diet instructions and recommendations after they're discharged from the hospital. So what does this actually look like in practice? Next, I want to just mention some different strategies that can be used to implement plant-based defaults in different types of food service settings. And here is just a listing of our top strategies that we typically use. We won't have time to go through all of these today, but I want to walk you through just a few of these to show you how they work. So plant-based defaults is the core strategy, and the concept here is to make the base of the meal plant-based and then give people the choice to opt in to meat and dairy. And a recent study showed that people are actually over 7 times more likely to order a plant-based meal from a menu that is plant-based by default compared to a traditional menu. So plant-based defaults, though, they do look different depending on the type of food service environment and the catering operation that you have. For example, if people are choosing from, say, a printed menu that has a lot of different options, then you can make the base of several meals plant-based, including a hearty protein. You want to make sure that that's always included in the meal, but then offer meat and dairy as an option add-on instead. And this is really pretty common practice for things like salads and bowls at many restaurants, where the base is veg, and then you could add on, say, grilled chicken or fish, for example. And so that's the same concept that we would encourage. Now, if you have more of a cycle menu with a limited number of choices, plant-based defaults also work really well in that scenario, because you can just offer the plant-based option first, and then if someone elects a different choice, that's okay, but you have a higher likelihood that they're going to accept the plant-based choice. And sometimes another way that you can operationalize this is to also have a policy of providing plant-based meals by default for late trays or patients that are away from their room when someone might come to take their meal selection, if that's the style of ordering that you have. And sometimes it's not possible to make the base of the meal entirely plant-based, but you can also create the perception that plant-based is the default by instead offering a minimum ratio of 2 to 1 veg to meat options. And a recent study found that when menus do shift from having 2/3 meat options to 2/3 vegetarian options, selection of those veg meals increased by 56%. So that was really significant. And this is just because, if there's only one vegetarian or plant-based option, the omnivores will perceive that as the special option that's just for the vegans or the vegetarians, and they don't consider it. But if we're shifting the ratios and we're providing several different veg options, then we are also shifting that decision-making process so that people are thinking more about the flavors and what they're in the mood for that day, rather than whether they identify as a vegetarian or a vegan. Another easy strategy is to make sure that the plant-based options are placed first on the menus and in buffet lines, rather than in a separate vegetarian section. The World Resources Institute found this strategy increased selection of plant-based dishes by more than 50%. So when there's a regular menu and a separate vegetarian menu, omnivores will think, well, okay, I'm not vegetarian, so I'll just stick with the normal menu. And they don't even consider the plant-based dishes as a real option. But when you switch those and they're in the main menu or the main service line of a canteen, for example, people are looking more at those flavors and the colors, and if that catches someone's eye, then they will choose it without really even considering the fact that it's plant-based. And along those same lines, another impactful strategy is just labeling foods with names that are more focused on taste and texture and provenance, rather than using labels like vegetarian or vegan or meatless. And to many people, using those terms might be a signal that a dish would be less filling or less delicious. But if you really focus on what is in a dish rather than what isn't, many more people are likely to choose it. And in fact, the World Resources Institute found that replacing the word meatless with flavor descriptors in a label increased sales by 76%. I do want to note that we also recommend that menus would still have maybe a small V or a leaf symbol at the end of a dish name, so that those people that are looking for a vegan or vegetarian dish for like a dietary or allergy reason, they could still find that, but you want it to just be more discreet rather than part of the title of the dish. All right, so now I just want to share a couple of case studies where we've implemented these strategies at different hospitals. One is that we recently completed a planetary health menu project with Vancouver Coastal Health in British Columbia, Canada. And that project really emphasized lower carbon protein sources for both lunches and dinners, as well as locally sourced foods. And what they did was they offered a plant-based default meal to most patients, at least one meal per day across their 2-week menu cycle. They also removed all the beef and most of the pork from their menu. And because of that, they were able to reduce the greenhouse gas emissions by an impressive 42%. They also addressed patient satisfaction with meals because they were adding more culturally relevant and different, just diverse protein sources, as well as really listening to what the patients and staff had to say about the new menu items, and they tweaked the recipes to ensure that the food was really delicious. And then after this pilot project ended, we helped them with a toolkit for expansion of these new menu items to other hospitals in their system, and that's being rolled out right now. Finally, here's the case study you've probably heard the most about, and Shireen mentioned this as well, and that is our work with New York City Health and Hospitals. We worked with them a couple of years ago to support their pilot of plant-based defaults for patient lunches. And what they do is they first offer patients 2 different plant-based chef specials. And then if the patients decline those specials, then they tell them the rest of the menu, which includes both plant-forward and animal-based dishes. And what they found was that more than half of patients selected one of those plant-based meals on offer. And approximately 95% of those patients were satisfied with their choice. So they had significant cost savings, and they were able to reduce their emissions by over 1/3 as well. You might also be aware that these plant-based defaults now are in place for both lunches and dinners at all 11 of their public hospitals in New York City. And the great thing about their menu is it also is just better reflecting the diversity and the preferences of their patient population. So we talked a lot about some data with these case studies, and that can certainly tell the story of a successful menu pilot, but I also want to mention a few other success stories here that have stemmed from some of the work that we've been able to do. And I think that one of those is just really working with fantastic hospital chefs who have become some of the most powerful and motivated allies for plant-based foods. And they've also really enjoyed the creativity that a menu project like this can allow. We've seen increased collaboration and resource sharing among clinicians, hospitals, culinary teams, and also sharing ideas at conferences, which really then leads to further progress. So there's just many more benefits beyond the data. And we've also seen menu projects have expanded to include patient and community education. So things like creating a recipe leaflet for patients to take home, or connecting the menu changes with other food as medicine initiatives, like teaching kitchens and lifestyle medicine clinics that just really help these projects become part of the continuum of care. And I did just want to also share a few quotes from food service and catering staff about their experiences working with a menu pilot project. In general, we're just really seeing a lot of motivation to implement sustainable plant-forward menus, and we believe this is the future of healthcare catering. So let's just review quickly what the Greener by Default process looks like and how your hospital can get started. Here's just a bit about our overall process. So first, what we would do in working with a hospital is to review your existing menus and propose a range of strategies like the climate-friendly ratios or plant-based defaults. And then once that you've selected, which of those strategies that you want to test, we would work with your team to design a pilot that fits your specific goals and your catering environment. And we typically would recommend that pilots occur in multiple phases so that you can collect baseline data and then gradually shift your menu and ease diners into more plant-based dishes over time. And during that pilot period, which usually runs about 3 to 4 months, we support your team with menu design, with project management throughout the process. And we can also provide communication templates, project launch presentations for staff, and other culinary guidance as needed. And when the pilot concludes, we would then analyze your data on purchasing, serving, and diner satisfaction to calculate changes in emissions, uptake of different protein sources, cost, and of course, diner satisfaction as well. And if there's interest there, we can also work together to publicize the results of the pilot. I just want to remind everyone too that our services are offered free of charge. We do a lot of work in the healthcare sector, and that is funded by grants and foundations that align with this mission. And so we're able to do that without charging any fees. We really just need to have health professionals across many disciplines to support this catering and food service transformation for the health of people and for the planet. And so I just want to end with a few ways that you can be involved in bringing more sustainable plant-based meal options to the menu at your hospital. Firstly, I would encourage you to think about how this could benefit so many patients in terms of the chronic disease management and also just symptoms and side effects management. This is not necessarily, that every patient in the hospital is going to need to have a plant-based meal every meal. It may not be appropriate for all hospitalized patients all the time, but it really is beneficial to the majority of patients and definitely to you and your colleagues as diners in the staff canteen if you were to change menus there. I would encourage you to advocate for more plant-based menu options with leadership throughout your trust. It could be, again, for those plant-based meal options for staff, because sometimes that's an easier starting point. But really the main thing is to lend your voice and support as a clinician, because that carries a lot of weight. You can also be a catalyst for change by connecting other colleagues who are passionate about sustainable food. And I would be remiss if I didn't mention that the catering staff, who are so critical to these projects, are fairly underappreciated, and they don't often receive recognition for their work. I know that they will really value your support, especially while they are operationalizing menu changes that are being made. And that's an important way that you can also support these changes. And as your trust or hospital adds more plant-based dishes to the menu, please try those dishes, try those foods yourself, and then tell others about it, which will increase their willingness to try it, especially if it's something that they haven't tried before. It might be a new food. And finally, I would encourage you to just think about, what is your next step? How can you move this conversation forward about menus at your trust or on a larger scale? Who can you reach out to? Who can you talk with about this initiative? Because it is important. So again, just greener by default, I want to mention that we are available to support you with a menu pilot. And this is offered free of charge to healthcare organizations as part of our collaboration with plant-based health professionals. And I am very happy to also be able to share that we've just recently brought on a UK healthcare manager, Amy Roach, who is an acute care registered dietitian based in the UK. And she has also completed an NHS Sustainability Fellowship. So we're excited to be working with Amy. We also have a short online interest form that you can complete as a first step if you would like to get more information, or you would like to set up a meeting with us, and we will be able to put that link in the chat here shortly if it's not already there. So thank you so much.
Brilliant. Let me just unpin. Heidi, hopefully you can see us all clearly. Brilliant. That was so fascinating and amazing to see how it all comes together and is put into place. So thank you so much, Heidi, and thank you to Shireen as well. Let's kick off with some questions, because I know all of you have got some burning questions for Heidi and Shireen. So this is a question from Ireland. Are you offering your services also in the Republic of Ireland, Heidi?
That is a great question, and I don't see why we wouldn't. Yeah, we're already working in several different countries, so absolutely.
Brilliant. So do register your interest using the form and the link that I just shared if you want to get in touch, and that's the Greener by Default interest form that I just shared in the chat. Can the Greener by Default offer a free services be used in schools, or is this just for healthcare? And the person said, this is so exciting, which I obviously really agree with. It is really exciting.
You know, we have got a few questions about working with schools, but right now that has not been our focus area. We really are focused on the healthcare sector. Outside of that, Greener by Default does also work with the corporate sector and university dining, at least in the US at this point. But those are the three main sectors that we've been focused on right now. There are some other organizations that are working with schools on plant-based meals, so I'm happy to share more about that if desired.
And just to add to that, maybe that we know that ProVeg here in the UK has their school plates program, and so we also sort of refer people who ask us about school meals to ProVeg because they've been doing such a great job for the last few years.
Yes, exactly. Someone has asked, has this been implemented in an NHS hospital as yet?
Yes, actually, we are in the process of concluding a pilot with a hospital in London right now. We don't have any data on that yet because it's still a work in progress, but yes, we are started.
Brilliant. And another question, very excited for this. Does Greener by Default help with cost incursion calculations or operational change in individual NHS trusts?
So a lot of the work revolves around being able to show impact for this work. And so we would definitely want to encourage collecting baseline and pilot data to be able to show those impacts. And that does include cost data as well.
Brilliant, thank you so much. And a question from Deborah, do you train the chefs in plant-based or culinary medicine?
So Greener by Default has not trained chefs specifically because that is something that many chefs usually have either prior knowledge of or other resources for. We do connect people with culinary consultants for some of that more in-depth training if that's needed. And then we do provide, there's many different free resources that are available online as well for some of that.
Yeah.
May I just add about the training of chefs here in the UK, because we do have a UK programme that is dedicated to training chefs called Forward Food United Kingdom. So I will pop that in the link. It's run through HSI, so Humane Society, but they've focused in mainly on university chefs to date, but there's no reason why they wouldn't do the same. So I'm just going to pop that into the chat for everyone as well.
Thank you, Shireen. And this was a more specific logistical question around the form. Is there any point in filling out the interest form before we have our key people within the hospital on board, or should it be when we're ready to go only?
Well, that's a great question too. So we are certainly open to having people fill out that form now and just registering their interest. We can connect with you. And one of the pieces that we do work with people on is just trying to figure out, just help people figure out, who are the best people to talk with and how to engage stakeholders and get that buy-in to keep things moving. So we're happy to talk with people and give them some initial ideas and support to get that going.
Brilliant. someone has, this is more of a comment, but great to hear. I'm very keen, but I work in an area which will be particularly resistant to change, although ironically it stands to benefit the most. And imagine it's already been done elsewhere, and the NHS will carry much more weight than the New York model. Do you have any comments or thoughts about that?
Well, I agree. It's great to have an example to share soon from NHS as well, and we'd certainly love to have more hospitals on board with that. And the great thing I think about the Greener by Default program and approach is that, you know, we're not suggesting that this has to be permanently implemented right off the bat. What we're suggesting is doing a pilot project to test out some of these ideas, to see what works, and make changes gradually so that it's much more palatable that way.
Wonderful. There's a couple of questions about soil health and whether Greener by Default has any view on that, for example, avoiding pesticides in food production, and just mentioning the link between soil health and the health of the planet. Is that something that is relevant to this initiative?
That is also a great question, and Greener by Default has not really focused on that end of it. You know, we've been working more with the food service and catering teams, as well as dietitians, on the actual food service operations. But Shireen, I don't know if you have any suggestions to add to that.
Yeah, and as you say, they sometimes have been separate groups, haven't they? And there's certainly groups within the UK working on the farmer transition away from animal agriculture. So there's some initiatives such as stock-free farming. There's the Veganic Organic Network that's bringing lots of local farmers together who are using veganic ecological methods to grow their produce. And of course, the issue around soil health is a global one to tackle, given that we've been using a very heavy tillage-based destructive way of farming. It's not really specific to kind of plant-based versus not plant-based. So yes, we do need to pay soil health great attention because we've degraded it over decades, but that is very compatible with a plant-based transition, and using principles of conservation agriculture that really pays attention to the soil health, moving away from the destructive kind of tillage-based system. So it's sort of parallel, but doesn't stop us moving forward with you know, transitioning dining alongside soil health.
Thank you so much, Shireen. And Sarah Bentley, who's the founder of Made in Hackney, has also put a link to the Made in Hackney's Plant Prospects programme, which does chef training in London and the UK. And there are hands-on practical workshops bespoke to specific chef teams. We have already addressed this next question, but I think it's always useful to kind of remind us all about it. The person said, great talks with useful info, thank you. Does this initiative only apply to patients or also widely to staff and canteens and the hospital meals for all the thousands of people working in the NHS, or probably millions actually?
Absolutely, yes. We have worked with hospitals on pilot projects for patient meals, for staff canteens, visitor restaurants, and even event catering. So any type of food service operation in healthcare is part of this.
I might just want to add that from my experience, seems
Shireen, I think you cut out for just a second.
Only just wanted to say my personal experience is it's often easier to start talking about staff meals before the patient meals because there's less sort of guidance and regulation around the sort of nutrition content. So it is an easier ask, and the catering manager is easier to contact, and you can start those conversations. So I certainly, if you don't know where to start, I certainly would start figuring out how and where the food for staff comes from.
Absolutely, I think I would definitely agree with that, and second the fact that it is sometimes an easier conversation to have to talk about staff meals, and also because it really aligns with healthcare staff values and wanting to walk the talk, and it's wanting to just do that for themselves as well in order to be able to say, okay, I'm doing this now, I can also promote this with my patients.
Thank you so much. And so this is a question that I'm sure you've heard so many times, Heidi. What is the best approach to overcome the resistance from the management of healthcare organizations if their given reason is we cannot force people into plant-based diets? We can't force everyone to do this. What is the best response we can give them?
And I think that's also really the beauty of the plant-based by default approach is that there is still freedom of choice there. We're not forcing anyone into anything. I mean, it's about promoting and marketing the fantastic, healthful, and more inclusive plant-based meals that are on offer, and not taking away that choice, because that is, I think, really still very important to have those options. But there are many benefits, as we mentioned today, from the inclusivity of plant-based meals to potentially reducing even risk of foodborne illness and food waste and cost. I mean, there's just so many different angles that you could talk about with this. So I think it's about finding what is going to speak to those decision makers out of all of these potential benefits.
Totally. I think we're sport for choice in terms of the benefits. There's a really nice comment which mentions Greener by default had completely changed the landscape of NYC health and hospitals. I had a friend at the Bellevue Centre, and not only was the menu plant-based by default, but also culturally diverse. Such a treat. So nice to hear positive comments. And then we also have a comment which is the person would be interested to hear an example of how the meals are introduced and how they might then move on to offer meals with meat if the plant-based meal is rejected. What's the process that happens there?
It's really tailored to the food service operation at each hospital, because we know, I mean, every hospital that we've worked with has been different in some ways in their operations. And so not every hospital has a setup like New York City Health and Hospitals, where they have bedside ordering and food service associates that are going around to every patient's room. But we would make sure that there is scripting in place, and the food service staff is trained in the ways to promote those meals that are on offer, and it would be very much tailored to that operation.
That makes sense. I'm just popping a link to our Plants First Healthcare report, which is also launched for everyone to get some more background information. So I know some of you were requesting that in the chat. And we have a question which is for Shireen. Do you have any educational material for patients that we see in an outpatient setting? And perhaps Heidi, you could also share as well, but we'll start with Shireen. What about educational material for patients in that?
No, good question. And we've spent the last 6 years or so as an organisation producing relevant material. And I know our fact sheets are very widely used. So if you haven't come across our plant-based health professionals fact sheets, that sort of general fact sheets, we have a plant-based eat well guide. We also have disease-specific fact sheets around many conditions, cardiovascular disease, hypertension, cholesterol, which can help get the conversation started around eating more plants when you have somebody that you feel is ready to make some changes in their diet. So as Rahini says, over 50 fact sheets ready for you to download now.
Yeah, we have something on absolutely everything, whether it's covering bloating when you're introducing lentils and beans for the first time, which is a common complaint for people who haven't been eating these fiber-rich foods, or more niche conditions, as well as hot topics like hypertension and high cholesterol, which is top of mind for so many people. But we also have things like a free 21-day plant-based challenge, totally free, no strings attached. The vast majority of our resources are completely free, and we do that to make them accessible and user-friendly, really colourful, and you're welcome to join our events. And any if you do sign up with us as a member, everything gets poured back into all the work that we do as a team. So yeah, thank you for the nice comments. Heidi, is there anything from the Greener by default side on this side of things?
Well, I think hearing about the 50 plant-based fact sheets that are ready to download now, I'm not going to top that. I think I would start there.
Yeah, we have so many videos, blogs, articles, over 90 webinar recordings like this with experts. So please do just spend some time looking at our website. And if you have any questions, that you can completely get in touch with us as well. And yeah, that's really great. So I think last few minutes, someone's actually said that their Sodexo catering team was very difficult to engage with any initiative, and veganuary was very poorly supported by them. Do you think that we could go in with a slightly different slant with this? Because obviously veganuary is, you know, going completely vegan for an entire month, and it is very much associated with veganism in the UK, although it's definitely taking on a different shape and form as time has gone on. Do you think you could still approach the same team with this as a different angle compared to kind of more vegan initiatives?
Absolutely. I think it's really all in the framing and the marketing of it, and you know, the words that we're using related to this. And so, yes, we would definitely suggest maybe talking through different ways that it could be promoted. I mean, sometimes it's even just the you know, the point of decision prompts that, for example, if you have a staff canteen and there's some signage there, you know, just the wording on that signage can also change things. And so, yes, definitely, if you focus on maybe it's plant-rich January or some other kind of wording that's just more additive versus reductive, if you will, that can make a big difference.
Wonderful. Well, hopefully, I think that gives, I think, as you've both shared, it's really finding what is going to appeal to that person that you're speaking to, whether it's your hospital dietitian or CEO. Everyone's going to have a different sort of angle on it. And it's, you know, highlighting things like those cost-saving benefits and the examples of what has worked in other places and what we're adding and expanding choices rather than restricting them, which I think is such a good way to lead on. So I think we'll wrap up there. This has been so incredible to hear more about your work, Heidi, and obviously Shireen, fantastic to see the evidence base for this. I think it's the benefits are irrefutable. And thank you everyone for the wonderful questions and for all your engagement. I am just posting the link again to the interest form so that you can get in touch with Greener by Default, and then do visit our campaign website, Plants First Healthcare, so you can take action. All the details on our website. We've got an FAQs page. It covers absolutely everything, and our report as well, which contains some of our own research findings. Is there anything else that you would like to mention or plug, Shireen and Heidi?
Well, from me, it's just share widely our campaign video, our open letter, and please take action by going to the website. We've made it awfully easy. Our website team, Mad Ideas, have done a grand job, so please use it and share widely.
Absolutely.
And I'll just say thank you again for having me on this webinar, and we do hope that you'll reach out to us through the interest form, and we look forward to speaking with you and making some progress.
Fantastic. Thank you so much. I've just popped a link into the coverage that we got in The Independent today, which features our initiative. So please do share that if you're on Twitter, Instagram, Threads, LinkedIn, TikTok, Facebook, any platform. Please do share. Even if you have 5 followers, you might change those 5 people's lives, and they may go and write to their hospitals and change 5,000, 5 million people's lives. So please do that. Our digital media pack is on our website as well, plantsfirsthealthcare.com, which has all these incredible infographics that I've been working really hard on with our designer, Kate Dunbar. So please do support. And this is not an initiative that ends today. So just because it's launch day today, this is going to go on for the next months, years. So please do support us to keep the momentum going, because as you know, we need to really stay kind of committed to this and to trying to see this in all hospitals. I think there's a long road ahead, but it's very exciting with all of your support. Thank you to everyone for joining, and lovely comments from everyone. Signing off now, and thank you, Heidi and Shireen, and good night.